Okay. So I'm doing this session because we had a pathophysiology lecture on HIV, which I was very appreciative of. I think it's important that we all know about HIV. However, I found it lacking in some information. And I want to, first of all, pay respects to my professors. When I approached Dr. Louie and Dr. Kinder about this information that was lacking, they were very receptive. They were very empowering. Professor Kinder got on me in an email and was like, please tell me all that information you want to be included in the next class. So I feel very respected and supported by my professors, and I want to reflect that back to them. All this is coming from a place of love and compassion, and because I think it's very important that us as practitioners have this knowledge. Okay. With that being said, the name of this slideshow is Fear, Stigma, and Ignorance, which is kind of heavy. I think to prepare for this lecture, I interviewed two different people. One is the head honcho in charge at Magnet. Raise your hand if you know what Magnet is. Of course you do. Um, it is the sexual health clinic located in the Castro that serves people of all different demographics because sexual health is public health. It is not just gay people health, despite what uh, stereotypes may exist. So I interviewed him. I just wanted some information on certain things that I already knew in my heart about HIV, but wanted to get it from a trusted source. And little did I know that he actually was HIV positive and was able to give me a great perspective on that. Additionally, I also interviewed my best friend, Sean from Fresno, California. I love him so dearly. Um, and he is also HIV positive. So I spent about 40 minutes each interviewing these two different people. I spent a couple of hours taking a lot of different classes on HIV mechanisms, transmission, HIV prevention, HIV treatment, uh, just so I can be better, speak with a little more authority when I talk to you guys and confidence about a reality that I've lived in for a very long time as somebody within the LGBTQ community. One thing that I've noticed, barring the interviews with people, was that in both our class and also in so much of the scientific research, is that what I perceive as some of the biggest driving influences on HIV transmission were never spoken of. And that is the title of this lecture, Fear, Stigma, and Ignorance. And so as we go through these slides, because there will be some research involved, I want us to constantly hold these words in our hearts and minds and try to find out how these concepts uh, find their way into what we're discussing. Sound good? By the end of this lecture, you will be able to answer. How is HIV transmitted? Raise your hand if you feel confident that you'll be absolutely able to answer how HIV is transmitted. Great. We'll see if you learned something new. What does HIV undetectable mean? Raise your hand if you know what HIV undetectable means. Great. Raise your hand if you knew what HIV undetectable meant before I went up to you and told you. Lovely. That's a difference, right? About half of the people raise their hand. What is PrEP and its various forms? Do we know what PrEP is? Raise your hand if you know what PrEP is. I just like to know. Cool. Um, how does stigma, ignorance, and fear relate to our modern HIV pandemic? It is a pandemic. It is global. What are key ways healthcare practitioners can reduce transmission and improve the lives of people who are living with HIV? This is the most imperative thing I hope you leave with today. Now, first off, this counts as a grand round. This also counts as a DEI grand round. Diversity, equity and inclusion, the bane of Elon Musk and Donald Trump, and also planes that like to crash. So, with that being said, raise your hand if you know why this is a DEI event. Can anybody tell me why? Not Dustin. Sorry, Dustin. Anybody? Come on. Come on. Thank you. Yeah. Do you think that people who contract HIV are only in the LGBTQ community? No. Great. We're off to a roarous start. This is starting off strong with way too much text on the screen, but I think it's important because we didn't really talk about this in class as to why this counts as a DEI. When HIV and AIDS was originally discovered, they called it GRID, which means gay-related immunodeficiency disease or virus. Yeah, the GRID virus. It also was known as the gay cancer. Um, Ronald Reagan, God bless his soul in hell, um, also this is much more candid than people get. Like Kinder likes her soapbox. I love it when she's on her soapbox. I'm gonna be on my soapbox. Soapbox. Um, he was pretty responsible for a lot of the negligence that came about with HIV and how it affected in many gay men deaths. This is a known fact. It was estimated in about 1990, from the discovery of HIV in the 80s to 1995, we lost about 1.6 million gay and bisexual men. That is something I think we need to honor when we discuss HIV instead of sweeping it under the rug. Um, Also, I mean, when we talk about fear, ignorance, and stigma, that silence that Ronald Reagan had put on the country, not just Ronald Reagan, but the whole country, right? It was looked down upon to be the minority, LGBTQ. Um, that silence killed those millions. They were unable to get the access and care. And it's not just the death that was the impact, it was a trauma left behind by living through that. Um, Do we know what this picture is? I know some of you do for sure. It is the AIDS quilt. So this is a picture from Washington, D.C., and that is a giant patchwork quilt that was made. However, some people don't understand that the AIDS quilt project began as the NAMES project, which began here in San Francisco. Cleve Jones, who I love dearly, I've met, he's a lovely historical man who's made such a huge impact in the LGBTQ community, friend of Harvey Milk, um, went during Harvey Milk's assassination, or a vigil for his assassination that happened in 1978. They had a vigil in 1985. He said, we're all dying. Nobody's paying attention. Let's take a piece of paper, march to the old SF federal building, write the names of everyone we know who has HIV, and paste it on there. And they plastered it all over. And he thought, wow, that looks like a beautiful patchwork quilt. And then that's when they decided to make this quilt that spanned bigger than a football field and really helped break through that silence that was killing people. That silence that also was preventing people from having proper funerals because families didn't want to acknowledge their fact that their child was LGBT who died, and funerals were too scared to have uh, processions of people who died from HIV. Fear and stigma and ignorance. Moving on, let's get to the science. Yeah, my voice. I'll try to enunciate and speak from my diaphragm. Okay, how is HIV transmitted? So this was a fun thing to study. HIV is a fragile virus and dies within seconds when exposed to light and air. HIV can only be transmitted through direct contact of blood, semen, vaginal fluid, and rectal fluid, or breast milk. So first things first, anal sex. Why did men who had sex with men, why were they at the highest risk? Because with anal sex, the probability for cuts and tears within the rectum during penetrative anal sex is high, which is also why the receptive partner, the bottom, colloquially, is at higher risk of transmission than the insertive partner. However, they are both at risk. Good on that? Great. Vaginal sex. On the global scale, just a interesting note, women are the cause, or women are the demographic at most risk for rising HIV infection rates, and that is through heterosexual intercourse. As what I stated above, you can imagine why heterosexual intercourse for a cisgender woman can make them at risk for HIV transmission. Sound good? Intravenous drug users. Sharing needles increases the chance of HIV transmission due to the blood exchange. Yeah. Perinatal transmission. Perinatal means around the time of pregnancy. So whether somebody has HIV, becomes pregnant, and can pass it on to their child, breast milk, or if they are at risk of becoming HIV positive while they're pregnant, that can have an effect on having a child born with HIV or contracting HIV. Oral sex. Can you get HIV through oral sex? Anybody know? No. I saw Dustin shake his head and I saw Caitlin nod her head. So this is a great point to learn. You are not able to get HIV through oral sex. This is something I've known because I've been constantly in conversation with sexual health screenings and nurses, and I grew up with a lot of fear around sex. And so I would have to anxiously ask, are you sure I can't get HIV through oral sex? And they said, well, it's incredibly negligible, the rate at what you, the risk factor. Maybe if you just got a tooth removed and then you went and had oral sex, perhaps if you had like that open festering wound, that could happen. But the likelihood of me having oral sex while I just had a tooth surgery is very low, I hope. Also, something interesting though is how is it that breast milk can transmit HIV, but not oral sex? And that has to do with lysis of your saliva, which we've learned about in pathophysiology. Breast milk resists the lysis that happens with saliva. So it will not be cut. The virus and the cell death will not occur with breast milk, causing it to transfer. Sound good? Understand? Moving on. Boom. So this is a graph about intravenous drug use, but it also just shows exactly what we just talked about. Females over here, greater incidence of HIV transmission through heterosexual sex, right? Heterosexual contact and injection drug use. Females do not have male to male sexual contact, so that's not there. There is no female to female transmission. Does that make sense with what we just discussed? Yeah. Additionally, in 2020 in the UK, they found that for the first time in over a decade, that heterosexual people were overtaking new infections over gay people and bisexual men. This was because heterosexuals were also far more likely to be diagnosed late. This compares to 29% of gay and bisexual men. This is also likely driven by the belief that they are not at risk of HIV, which is often reinforced by healthcare professions. How are HIV transmission rates reduced? Frequent STI screenings. Does that make sense as to why that would reduce, right? If you know your status, you hopefully would not want to transmit it to other people. PrEP. If you already know what that is, it's a way to reduce transmission rates, and we'll get into it. ART for people living with HIV. That is antiretroviral therapy. It helps them control their viral load. It's going to help them prevent transmitting it. Harm reduction and needle exchanges for intravenous drug uses. And then this last one where I clumped them all together because I kind of have a weird issue with it. They were in the research slides, but you'll find out why I feel a little bit weird about condoms, abstinence, and circumcision. They say voluntary circumcision can help reduce HIV transmission rate. And what we know with how it is exposed to air and it dying, having an uncircumcised penis, have that mucosal membrane hold on to that in a airtight space. You can imagine how someone being circumcised can reduce their rate of transmission. Does that make sense? Now, I don't know how you, I want you to imagine as somebody who is uncircumcised, hypothetically, how likely are you to be voluntarily circumcised to reduce rate of transmission by 50%? Condoms, which we'll find out on the next slide, consistent use of condom usage lowers rates of transmission 60 to 70%. So I'd much rather use a condom than have a surgery that's very invasive. And abstinence. Who's familiar with abstinence? Who's familiar with how much abstinence works? Who's seen Mean Girls when he says, you have sex, you get pregnant, you die, right? That is something that I grew up with and something that did not work. HIV prevention and treatment. Antiretroviral therapy, ART. In our class, the pathophysiology class, it was described as HART. And I did my best to find out what is HART, what is ART. I talked to the head honcho at Magnet, and I had to do my research to realize that they are not the same. And there's a very significant difference as to why they are not the same. HART is highly active antiviral treatment. It was developed in around 1995. It significantly improved the chances of survival for somebody with HIV in 1995. However, it was really, really, really rough on the body system. It was so rough that they actually delayed administration of HART until you were almost stage 3 HIV. Stage 3 HIV is what was formerly known as AIDS. We don't use AIDS anymore because it's much more of a spectrum as we understand it. Stage 3 is the most risky place to be at. And what they refer to is your CD4 T cell count, which is what HIV targets. Normal range of your CD4 count is between 500 and 1500 cells per microliter, the little U with the L. AIDS, or as we now know it, stage 3 HIV, is when you fall below 200. Okay. HAART was delayed treatment until you fell below 350. So you were quite at risk. That's how hard it was on the systems of the body. So they want to make sure you were right at the edge, which is not great for people. It was very disruptive. And back then, with HART, it increased life expectancy of somebody who was 20 years old who became HIV positive to like 40 years old and 50 years old. And at that time, that was good. That was great. But since then, we've developed new medications that actually has made it much more manageable and has increased life expectancy of somebody with HIV to 70 and up. That is something that I think is very important, and that is why HART is outdated and ART is in. We love ART, yeah? ART also includes medications that are prescribed as PrEP. ART is treatment. If I'm HIV positive, I'm taking ART. If I'm HIV negative and I don't want to become HIV negative, I take PrEP. What is PrEP? Any questions so far? I'm moving very fast. Good. PrEP, pre-exposure prophylaxis. It is a medication regimen that vastly lowers chances of HIV transmission if exposed to a viral load. Okay? I put it up here. Let me move this just so you can really see. That condoms reduce HIV transmission risk by 60 to 70% when used consistently. That's great, although are you able to pass a class at UCSF with 70%? No. You would hopefully want a little bit more than 70%, right? You don't want to remediate that class, especially if it means you become HIV positive. So I would like something that works better. Turns out there is something that works better, and that is PrEP. PrEP works if you take it. Now, if you look at the research, it'll say 99%, 99%. There are cases where it doesn't protect. Whenever I ask about these cases, it's very hard for me to get an actual answer as to what happened. One thing that is common is that it is not taken consistently. If it is not taken consistently, if you do not have it high enough in your blood system, you can still contract HIV. And if you have some in your blood system but not enough, it's actually not great because the virus can mutate and develop a resistance to that drug, which will then make it harder to be on ART because you have to find other drugs to be a part of. Does that make sense? Now, I have a long and storied history with PrEP because a lot of the PrEP clinical trials happened in this very city, which is why I was a bit surprised when the school that's based in this very city with a lot of research base was not including this kind of information. Um, when it first hit the market, I found out that there was something that protected me from HIV at a greater success rate than condoms, and I wanted in, but it was being tested. So I found my way into a clinical study trial. The clinical study trial would pay me $125 every time I went in. I would have to take PrEP every single day, but they were also testing a new version of PrEP, a microbial gel that I would have to insert into my rectum to see if this would maybe help people uh, have better adherence to PrEP. If we have a large amount of this treatment in a gel that I use before sex, will that be easier to adhere to than a constant pill that happens every day? I will tell you, it was not fun, but I did get to know my body very well, and so did the people who did the clinical studies. I had many funny anecdotes about that, but I digress. I did get constant medical screenings. I got paid to show up. I got tested and I got free PrEP. And after that, they gave me free PrEP for the rest of my life, basically, or at least as long as they could. And then it doesn't matter if I have PrEP for the rest of my life because there are services out there that will give you PrEP and they will do their best to give it to you for free because originally it was like $2,000 a month, which is way too much. So, PrEP options, oral PrEP, one pill a day, known as Truvada initially. Then they turned into Descovy. My username on the apps was Hakuna Truvada for a bit because I was so happy to be on PrEP and I loved sharing that information with people. Um, Truvada was TDF, Descovy was TAF. TAF, the newer version, is higher in concentration and faster in pickup in your body, but both are effective in preventing HIV transmission. Yeah. There are certain risks about bone loss and kidney function because you are taking a drug every day. Your kidney has to process it. Ultimately, your body acclimates, and that those drugs have a negligible effect on your body. However, there is also the 2-1-1 strategy. So when I'm on PrEP, you have to take it for a week straight before it is at a good enough dose so that I can feel safe to feel protected enough, yeah, for the efficacy to work. However, say I don't have PrEP, but I do have access to 4 pills, or maybe I haven't been taking it often, but I know I'm going to have sex with somebody, and I know at least 2 hours ahead of time. 2-1-1 strategy. I take 2 pills, I front load it 2 hours to 24 hours before initial sexual contact. Better closer to 24 hours, but 2 hours can suffice. Then, after sex, 24 hours later, I'll take 1 extra pill. 24 hours after that, I'll take another extra pill. That works. It's a great way if people don't have it in their system but want to be protected. That is an option. It's a bit hard because 2 hours, how do you foresee if you're going to have sex? I don't know. That's one thing. What I'm on now is the injectable prep, which is cabadagavir. Caba. I don't know. Um, but I know it when they call me. They give me an injection. I prefer the left side now because every time I do the right side, I get a lot more soreness. It is intramuscular. It happens once every 2 months. So now, instead of getting tested every 3 months as I would on PrEP, I get tested every 2 months for everything, for all STIs. Hooray! I'm very healthy. I know a lot about my body. Um, Side effects are that soreness, that muscle soreness, a little lump is built up. Ouch, I don't like that. But at least I don't have to worry about missing a dose of pills. I'll tell you what, I miss a lot of my ADHD medication pills daily. So I'd rather be missing that than PrEP. Yes, go ahead. Cabotegravir. Apretude. There you go. Thank you, John. Um, During my research, I found out that there's a new one, lenacapavir. Love these names. This one is subcutaneous, so hopefully I will no longer have that sore butt for a week straight. Additionally, you only have to have it 2 times a year. It's not out yet. They're pushing it. I can't wait to be on it. And it gives you much more coverage. Yeah? We all good? Question? A little louder, please. Of effectiveness between injectable and oral? Yes. Yes. The reason why I decided, because I'm like, do I even have enough sex to warrant getting this injection? That's a big hassle. They told me it is more protected. You have more efficacy. And keep in mind that efficacy for just oral PrEP, when consistently taken, is less than 1%. So having something even more, I mean, I love number go up, you know what I mean? So that's why I take it. Both PrEP and ART have been successful in reducing perinatal transmission. Fantastic. Imagine if you were a woman who was in a relationship with somebody who's HIV positive and you desperately wanted to have a baby, but you're constantly in fear of passing HIV to that person. You could be on PrEP to make sure your baby doesn't get HIV. Amazing. Imagine if you're a woman who wants to get pregnant, but you have HIV and you're living with HIV. If you are on ART, it helps reduce the risk of passing HIV onto the baby um, exponentially. Yeah, we'll learn more about that in just a second. PrEP inequities in the US, region by race. So we have the Midwest, the Northeast, the West, and the South. The line being high is good. That means people have access to PrEP. Notice where the line is the lowest is in the South, the American South. Also, notice that that green line is white people. And those other lines that are very, very far below white people are Hispanic and Black people. Black people, by far, have less access to HIV and are much more at risk of HIV transmission. Across 46 demonstrations, HIV incidence with people who had PrEP was less than 1%. Hooray. PrEP has follow-up appointments, which is great because what are we doing? Knowing our status, checking our kidney and liver functions, our kidney and liver functions, counseling, active counseling. So if we have any questions like, can I get HIV through oral sex? They will tell you, no, it's very negligible. And then I will feel safer about having sex. Yeah. However, we have these inequities that disproportionately affect Black and Hispanic people, and 50% of all new infections occur in the South. Now, with this information, I want us to think about stigma, class, race, all those things we never really talk about as risk factors when we list, or I guess we do talk about race as a risk factor in so many parts of our class, but we never really talk about like when I see race is a risk factor, I'm like, oh, is there something genetically within that person, that race, that makes them predisposed to uh, getting this disease? And the answer is more often than not, no. The unspoken truth is access, class, racism, and stigma that really powers all of this. Does that make sense? I think one of the best ways to combat this, to combat the ignorance around it, is by proactive knowledge. And the fact that you guys are all here today means you're already part of the solution. So pat yourselves on the back for that. Additionally, more medications for HIV negative people. PEP. PEP is post-exposure prophylaxis. Let's say I'm not on PrEP whatsoever. I find myself highly suspecting I was exposed to HIV, to a viral load of HIV. I don't know what to do, but within 72 hours, I can go straight to get treated on PEP. Every hour counts within that 72 hours. It is a concoction of 3 different drugs, and we want to get you on it as soon as possible. You take these drugs over the course of 28 days, and that has been able to prevent seroconverting. Seroconverting means becoming HIV positive. Yeah. Only in emergencies. I talked to the head honcho. He said, if a patient came in anxious of HIV from exposure to oral sex, I would not administer PEP. Hopefully this makes sense to us now as to why you wouldn't. Yeah. Additionally, doxypep, doxycycline. Has anybody ever heard of doxycycline? Yes, it's an acne medication that people take daily. It can also prevent malaria. And also, when you take it after exposure to, or after sex in general, if you were exposed to an STI, it significantly reduces the infection rate of that STI by 60%. I will tell you, within my conversations with nurses when I was getting prescribed this, it actually is higher than that for syphilis and I believe chlamydia, but with gonorrhea, it's 60%. So it's like more like 90% for 2 of them. And then the other one's a little lower, which brings it overall lower. Yeah. That makes sense. Now, STIs increase the chances of HIV infection. So doxypep is a good strategy. Recap to see if we've really congealed this. Why do you think an STI would increase the transmission rate of infection? What are some symptoms with an STI? Yeah. You said, is it like open wounds and stuff? Absolutely. Any STI that has the symptomatic stage of like genital ulcers or anything like that, that is an open wound. That's going to severely increase transmission risk, which is why doxypep is a great way to combat HIV transmission. Doesn't directly, is indirect. That makes sense? You can get all of this prescribed to you if you have sex with multiple partners. Actually, I don't even know if that needs to be there. I think you just go into Magnet and say, hello, I would like medicine, and they will do the interview. They will intake you. Doesn't matter what your body is like, doesn't matter your sexual orientation. Their goal is to prevent uh, infection. Harm reduction for people who inject drugs and its effect on HIV transmission. The syringe exchange program has been widely implemented as an HIV prevention intervention. Do we know what the needle exchange program is? Raise your hand and tell me if you know. John, you raise your hand. Harm reduction. So they know that people are going to be doing drugs and injectables. So in order to reduce harm, uh, they have this program where like, you turn in your like absolutely. So John was talking about the harm reduction aspect. Again, with Ronald Reagan, God bless his soul, pioneered the DARE program. Actually, I think it was more like the Say No to Drugs program, kind of like abstinence if you think about it. not very effective. So the opposite of saying no to drugs, which I think increases stigma, that message, constantly saying no, um, is acknowledging that you will be using drugs and how do we reduce the adverse effects of drug use. So they will have a needle exchange program. I'm somebody who is injecting drugs. I would like some needles. They're hard to come by. I know a place that will provide me with free, clean needles. I would love to go there. They're providing me with this, letting me know that they know I'm going to be doing this drug. That acknowledgement already is reducing the stigma. And as you're reducing that stigma, you say, hey there, while we're giving you all these things like condoms, alcohol swabs, and needles, you want to get tested for HIV? That'd be nice. And they say, well, while I'm here, might as well, which will help them know their status, which is a great way to prevent transmission of HIV. Does that make sense? Um, ba ba ba. 8% of people with HIV who inject drugs do not know their status. Um, These are some stuff that they include: alcohol swabs, sterile water, mixing vessels, filters, training on safer injecting practices, and overdose prevention, instead of just pretending it doesn't exist and sweeping them under the rug. Because of this, has reduced 50% reduction of HIV and HCV incidents attributable to syringe service program. That is lovely. Additionally, effective treatment for substance use improves adherence to ART. If you're adherent to ART, you're not going to be transmitting as much HIV. If I'm getting treated for substance use disorder without the stigma, um, that is going to increase my chances of that treatment adhering. Does that make sense? So real quick, I want you to imagine right now, regardless of how it wouldn't make sense if you are having sex or not having sex, you just found out you are HIV positive. I want you to sit with it and imagine how that feels in your body, what kind of anxieties you may be thinking of, what kind of fears. And I want to ask you, how do you think your life expectancy is influenced by becoming HIV positive? If anybody has a hand, please raise it so you can answer. I beg you to answer. Even if you don't know that's an answer. How is your life expectancy influenced by becoming HIV positive? Nobody? Cassandra. Cassandra says, I was going to say decrease, but I don't know how much. Josh.
I would also say decrease, and then I would think like back to like people who have had it, like Magic Johnson, but then I'd be like, he's rich, so
He's
it's
rich.
a little different.
He's rich. It's different.
Yeah.
Remember, PrEP was $2,000 when it first came out. Additionally, how do you think about your future in having sexual relations and intimacy with other people? You think it's going to be affected? In what ways do you think it's going to be affected? With that being said, let's talk about ART. ART and HIV undetectable status. Don't look at the screen, even though you already did. What does HIV undetectable mean? There's a huge campaign that says HIV undetectable, viral load means HIV is untransmittable. That is something we didn't talk about in class, and I think that's one of the most important things to take away from this lecture. This is supported by all of these studies. There's no link transmission with somebody who is HIV undetectable. This requires the following. They are taking ART, their medication therapy. They are also achieving and maintaining that viral load. As soon as you take the ART, that does not mean you're undetectable. You have to control those levels, kind of like diabetes, through that medication. Yeah. And understanding that if ART is stopped, you are no longer undetectable. You are no longer untransmittable. A fun fact of me is that if I was going to have condomless sex with somebody, if I was going to have condomless sex with somebody, and I say condomless, not unprotected, because as we know, condoms protect somewhat, PrEP protects somewhat. there is a spectrum of protection. So having a binary of unprotected versus protected in our language is inaccurate and dangerous. Yeah. So if I'm going to have unprotected sex with somebody, sorry, I messed up. If I'm going to have condomless sex with somebody, and my option is with somebody who says, I am HIV negative, and my other option is with somebody who says, I am HIV undetectable, I'm going to be candid and say I will feel safer having sex with the person who is HIV undetectable because I know they are constantly getting tested for their viral loads. I know that is within their own self-preservation tactics to be on ART and make sure they are undetectable. And I know that they know probably a lot more about HIV than the person who claims that they are HIV negative. There's also an incubation period. So sometimes you can get tested, you'll come up okay on the test, but you won't actually know if you're HIV positive if you just seroconverted. Yeah. Risk factors. So here's some interesting risk factors. If you notice this area, this is like slides I took from the classes I took online. I love the classes, but I also did not. I did not like the ways that they worded things. I don't like those studies that were done. I think that there was a lot of flawed aspects to it. Let's talk about the key population. 28 times higher among men who have sex with men than adult men. That's funny. Are men who have sex with men not adult men? I don't know. This is just semantics for me, but it's also kind of weird that you would say that. Whatever. 35 times percent higher in people who inject drugs. Okay. 30 times higher for female sex workers than adult women, because I guess adult sex workers aren't adult women. 14 times higher for transgender people. Fun fact, they didn't do a test on male sex workers. Why? I don't know. So on to the unspoken risk factors. Sex workers face high levels of stigma and criminalization almost everywhere. Modeling studies indicate that decriminalizing sex work could lead to a 46% reduction in HIV infections in sex workers over 10 years. Decriminalization, not regulation. Decriminalization. Um, and eliminating sexual violence against sex workers could also lead to 20% infection. Now, in the spirit of what this lecture is about, stigma, fear, and ignorance, I think some of the best ways to combat stigma, fear, and ignorance is compassion, empathy, courageousness, and proactive knowledge. And with that, I would like to disclose a little bit about my own personal life. I'm somebody who has engaged in sex work. I'm proud of the fact that I've engaged in sex work. I feel like if you do a good job at something, you should be proud of that. And I did a good job of it. Additionally, my best friends engage in sex work currently. I currently no longer engage in sex work. However, that gives me the platform and the privilege to speak about the stigma against sex workers that my friends who are sex workers do not have because they fear retribution by the legal system. My boyfriend growing up was a sex worker who was also homeless. He also did Reiki and yoga and all kinds of things, massage. Very, very talented man. Um, it's something very near and dear to my heart. It is something that is the world's oldest business, and yet we criminalize it and pretend it doesn't exist. And we think about stigma and fear and ignorance and how this plays into HIV transmission. It's no wonder that sex workers are at such an increased risk of HIV transmission. We talk about risky behaviors. They talk about people who have multiple sex partners. I imagine multiple people in this room might have multiple sex partners, um, but they also might not see themselves as part of these key populations. Yeah. How do fear, stigma, and ignorance, how are they the perfect cocktail to keep people ignorant of their HIV status, keep people from accessing PrEP and ART, and engaging in risky behaviors without disclosure. So, a tale of two lovely best friends. My personal experience. I had a gay uncle who died of AIDS, as we now know that's HIV stage 3. I never knew he died of AIDS. I never knew he was gay. I did know that when he died, I felt very sad. And I did know that when he died, nobody really told me why until I came out of the closet. And my mom said, is that what you want? Is that the future you want? This increased a lot of fear, stigma, and ignorance around sex and HIV. It was very interdependent and intertwined in my life. A source of a lot of trauma when it comes to intimacy is that fear that you will die, just like Mean Girls. However, as you know, I had direct access to PrEP, to the PrEP studies, to the medication. It changed my life. There was one time I had a friend, a lover, who seroconverted, who became HIV positive, who felt undesirable, who felt broken, who felt depressed. I was on PrEP. I knew how protected I was. I used a condom. I did have sex with him. And there was something so beautiful and empowering that I could be there for a lover of mine, feel empowered in my own health and safe, and in a way instill a sense of safety in the person who's going through a very, very traumatic experience in their life. My gender presentation has kind of shifted. Um, Not personally to me, but to everyone else, yes. My hair grew longer. I wore a little bit former, tighter fitting clothes, but I don't feel any different. But the people I sleep with look a lot different. No longer am I sleeping with gay men. Um, I instead have seen a much more increase in people attracted to me who are straight or bisexual men. And I've noticed something very interesting about that. There is a false sense of security that these straight men and bisexual men and DL men have to the mention of PrEP, of something that is very helpful that maybe they should have access to if they're going to be having sex, anal sex with people. Yeah. They say things like, I'm picky. Don't worry. I'm really good at knowing who's okay to have sex and who isn't. They'll say, I only have sex with people I trust. And I think about what that word means in terms of a hookup. Um, and then they also say something that I hate. It's called they say you're clean, right? Instead of HIV negative, implying not only that if you're HIV positive, you're dirty, but also showing their own ignorance around the subject. And ignorance is one of my personal ideas of a risk factor, right? I feel like these people need access most to Magnet in the city. Do you think they will be caught dead going to a clinic that is known to help people who are LGBTQ? Probably not. Now, here's my best friend, Sean, his personal experience. He was in a monogamous gay relationship in Fresno, California. Monogamous. He went into the Navy, was having a pretty rough time in the Navy, not want to be in the Navy, having a mental health crisis. They took him in. They did some tests on him. They said, oh, you're HIV positive. Go sleep in that cot over there. They did not have any information to provide to him. They broke some very traumatizing information to him without giving him any kind of support. After that, he came back. That was October 2014. He came back to his doctor, to his primary care physician, who was his family doctor for quite a bit. And he said, I don't believe you have HIV. I don't think that's true. I'm going to test you again. Tested him again. Oh, you do have it. Why would a primary care physician not believe? I don't know. Maybe it's because he's a family doctor and has his own stigma about people with HIV and gay people. Um, he sends him a referral to an infectious disease doctor. The infectious disease doctor says, we'll see you in 6 months in April. As we know, ART is needed to be done ASAP so that it reduces transmission rates. If Sean was a different person, He could have spiraled into drug use. He could have found himself doomed, scared, and kind of given up on life and maybe will make kind of risky, detrimental decisions to his own life and to others. It took him so long to get access to ART. In fact, during April, he went in for an exam and they said, "Oh, we don't have your labs. We need to do labs. I'm sorry, we need to do different labs to make sure you like have the specific strain of HIV. Come back in a month." That month comes. "Oh, we're canceling your appointment. Some stuff came up." So he gets very angry, complains, has to advocate for himself. They give him a different doctor who is immediate and ready to serve him because of the complaints. It took him 9 months to start ART. 9 months of not being HIV undetectable, 9 months of fear and trauma, and 9 months of confusion and doubt, not knowing what the rest of his life is going to look like. His partner, who also seroconverted, was a veteran, got treatment within 2 months. Hooray. What is the difference here? Why does that happen? Was it because, or I'll tell you, it's because the doctors knew what to do with his partner. The doctors were a little bit ignorant of terms like HIV undetectable, of terms like pre-exposure prophylaxis to my friend Sean. After beginning ART, he was only tested every 6 months to see his viral load. And within a year, or after the second meeting, he was undetectable. So that means in 6 months, he was not undetectable. But maybe after that he was, but it took a year for him to be confirmed undetectable to have that peace of mind. The person, Chris, who I talked to, the head honcho at Magnet, he was undetectable within a month of ART. Okay. So last two slides, most important ones, going a little bit. Oh, I'm not over. Great. So I asked my friend Sean, "Dear my best friend Sean, how could the healthcare practitioners have better helped you in 3 moments?" One, before HIV infection, he told me, knowledge to access, knowledge, I'm going to cry, I'm sorry. Knowledge and access to PrEP. It was already becoming a thing back then, 11 years ago. And my doctor knew I was gay, but he didn't know what PrEP was. I had to explain that to him as well after my diagnosis. I don't know how I had to educate a doctor on the kind of medication that I needed to protect myself. That should be information the entire medical community knows. That there's a medication out there that not only keeps our patients alive, but keeps them from spreading this disease that has been ravaging our community since the 80s. Dear my best friend Sean, how could healthcare practitioners have better helped you when you found out you contracted HIV? The most critical thing I needed at that time was someone to talk to, a doctor who could tell me that I was going to be okay and get me on the path to getting the medication I needed. All I really needed was reassurance I was going to be okay, and it took almost a year for me to get that. It was a traumatizing 9 months, and it all could have been avoided with a simple conversation with someone who was educated. Sean, how could help care practitioners better have improved, have better helped you now? Now I don't need anything from my doctors anymore because I have educated myself so I can find whatever I need on my own now. It's sad that that's the case. I would like the doctors to have all the tools, but for someone who is where I'm at now, they can't help me anymore. I can only help myself. I fear for places where they have less knowledge and access to these resources whose HIV infections are on the rise, like in Florida. Dear Sean and Chris, who was a nurse from Magnet, who happened to be HIV positive, who I interviewed. Now that you have seen how our lecture for HIV was limited, what do you want to tell my classmates who will be future physical therapists? Sean, a huge part of my trauma from when I was diagnosed was related to the fact that the only information that my doctors could give me was the information on those slides, which is honestly just terrifying information. It could just be chalked up to bedside manner, but I think it'd be good medical care to know the full extent of everything we talked about, from the mental health side to treatment and prevention. Chris, the lack of HIV knowledge is not specific to your program. It is endemic to the entire healthcare profession. I think one of the most important things to know about HIV in the modern era is that it's more of a chronic condition, and with adequate care and ART, people like us can enjoy the same life expectancy as everybody else. Now, these are my references. They're very badly done, but I just needed something just in case I, you know, can keep track and maybe rehash this out. But with this lecture ending, I want us all to think about those words we started in the beginning: fear, stigma, and ignorance. I want you to think about how, apart from this lecture, fear, stigma, and ignorance live within you, within your own life, how you are affected by it, how people you love are affected by it, how politicians are affected by it and utilize it. And I want everybody in this room to imagine a future that is better than the one we live in right now, and how we can affect that change within our own practice. Thank you so much for coming. If anybody has any thoughts, you're welcome to see me at a different time because we have class right now. So thank you.